we saw is that there's a lot that patients actually struggle with on the mental health side. Right? I mean, a cancer diagnosis is something that's really comes as a shock to patients, and that's deeply affecting the whole life that these patients are going through. And we wanted to give them basically a tool in their hands to say, this is something that I can rely on. These are pieces of information and concrete steps I can take to make this life with cancer now the best possible for me. And that's the change that we are bringing about with Mika. We've built a great product over the course of several years. We validated this in clinical trials, and we can really proudly demonstrate and showcase that this really works, right? That patients who use Mika are much better off than those who don't. In various dimensions. This is quality of life. This is psychological distress, anxiety, depression, fatigue. So really, things that patients are deeply affected by. Berlin MedTech, I think there's more and more coming up. And of course, digital health plays a big role in this. I think we've seen a big wave that coincided, but not only because of the digital therapeutics reimbursement scheme that was implemented a few years back. I think the enthusiasm has sort of flattened a little bit around that, but there's still company coming up with that with new offerings there. And I think what was the maybe e-commerce a few years back. There's probably more focus on more purposeful businesses now. So in the internet business world, there's now a lot of healthcare also happening. So we see more and more of that. There's, of course, also classic med device, physical devices being developed. But I think that's typically not so visible to the startup world, and slightly different domain. In terms of where Mika will be in 5 years, that's of course a slightly different story. We have embarked on a geographic expansion. So we actually launched the offering in the UK in November last year. We're looking at adding more this year, and we'll probably launch in the US in the second half of 2023. So we're taking Mika global basically, and that's I think a very interesting path because of course it's new territory for us. But we see that actually the problems of cancer patients and the things that they suffer from are very comparable. I mean, health systems are different, and where people are treated is different from country to country. But the drugs are the same, and the side effects are the same, and people worry about the same things, or at least similar things. Right? So there are cultural differences, and we invest, of course, to cater to those needs as well. Large industry players always have typically a fairly stiff organization, and I think that's something that we bring to the table, where I think we can allow people to develop in a more flexible career trajectory. So that's one thing. Of course, we are still a reasonably small company. We're about 50 people. And so I think communication is a lot easier to that effect. Also, I think the effect on the patient with your own ideas is much more direct if you want to cause a change in the product. So I think that's a couple of the points that typically speak for a smaller company or a startup. At the same time, I think we have a very ambitious roadmap ahead of us, and the geographic expansion brings things about that you can really drive forward and develop as an individual. We are also very purpose driven. The patient is in the center, or patients are in the center of what we do. That has been true and will always be true, because we think that's the only way to build the best possible product out there. So I think that's something that definitely speaks to a few people looking for new opportunities.